All right, welcome, folks. Thank you so much for coming to today's session. My name is Amy Banco, and I am a faculty member at Rutgers University in the Psychiatric Rehabilitation and Counseling Professions Department with the Integrated Employment Institute. My work focuses on helping practitioners in their implementation of evidence-based practices for people with mental health conditions. I've been in the field um, since 2013, working in the capacity of a rehabilitation counselor. I have my LPC. I have provided direct service in supported employment, supported education in the state of New Jersey. I've also worked in supported housing. I've supervised large teams of providers and currently am fingers crossed, completing my PhD in counseling supervision and education. So this is definitely an area of expertise, interest, and passion. I want to thank everyone for being here today to learn a little bit more about how supervision can be a part of the way in which we strengthen services programs. If you are coming in today as a supervisor, these tips and tools can be assistive in the work that you currently do. If you are coming in as a direct service staff with aspirations to become a supervisor, you can continue to kind of hone and build your knowledge and skill sets on that career pathway trajectory. Additionally, if you are a direct service provider and you are someone receiving supervision in that capacity of a direct staff person, oh, I hear a little background noise. Just going to mute that. If you are coming in as a direct service provider, this can help you to think about, what you'd like in your supervisory sessions and how you can advocate for those needs to hone your supported employment and supported housing services. I just want to be mindful, we are recording today's session. Additionally, if you come in, please mute your microphone. This is an interactive session. Today will be there'll be opportunities for you to interact with your colleagues in this virtual space, where you can look at tools, worksheets, and bring to life through activities and discussions and exercises some of the material that we'll be working on. So please be prepared to enter breakout sessions, to have your camera on if permissible, to have your microphone on so that you can interact with your colleagues and deepen your understanding and application of this topic. I want to note that, again, this is a three-part series. We'll be hosting these monthly, really looking again at cultivating competencies and work environments that can strengthen service provision as well as outcomes and job satisfaction, retention of workforce, right? There's a lot of benefits to focusing on this topic. So welcome, welcome. I'd love to learn a little bit more about everyone here in this virtual space. So please feel free to introduce yourself in the chat. You can share your name, your role, right? What you do at your agency, if you are a supervisor, if you have supervisory aspirations, and you can, share what organization you're coming in from, what program modality you work in. Maybe it's supported housing, case management services, whatever you are feeling comfortable in sharing. Please go ahead and put that into the chat. I see some folks, care specialists.
May I interrupt?
Oh, go right ahead.
Oh, yeah. So I am on the phone via phone because my computer did not want to work with me. And so I do not have the link to log in via Zoom.
Oh.
Just the phone number.
Okay. Are you able to access your email?
Yes.
Do you want to put your email? Oh, no, you can't put your email in the chat because you're on the phone.
No.
I am not sure the best way to get that link to you right now. My apologies.
That's okay. It's technology, There's some things out of our control. So I will just be listening
Can he
via
give us
phone today.
Can he give us the email and we can type it in for him?
Oh my gosh.
Yeah,
Yes.
would that be okay?
Yes. Yes. Perfect. It's Stephen, S
Hold on.
is in Sam.
Yeah.
Okay.
Is somebody going to type it or?
I am typing
Yeah.
T-E-V-E-N
VEN. S is in S is in Sam.
mm-hmm,
At Thrive. That's THRIVE. The
mm-hmm,
number 2
mm-hmm.
survive WA.org.
W-A
A
dot O-R-G.
.org. Correct. So Stephen S.
Perfect.
at Thrive to Survive WA.org. Thank you guys so much.
If someone could please send Stephen the email, forward the email with the link, that would be greatly appreciated. Thank you. Thank you, Stephen. I see a lot of
Thank
folks
you.
joining in. Employment case managers, a clinical support specialist supervisor. Fabulous. So many wonderful services in Washington represented right in this virtual space. It is great to have you here today, where we get to, for the next 90 minutes, focus on your skill sets and how to really bolster them. As a gentle reminder, today we are, this particular session, this webinar, the series is hosted by DBHR through the Washington State Healthcare Authority. And I noted it's going to be an interactive session. I encourage you to participate, ask questions. You can certainly unmute or enter things in the chat. I want to make your time here really meaningful, intentional, that you're leaving with something purposeful and beneficial to what you do in the amazing work that you offer in Washington. Please note that the use of automated note-taking bots, similar tools during Washington State FCS events or meetings require prior approval. Unauthorized use of such tools is prohibited, and to ensure that, we have privacy and confidentiality of attendees in the session. Any recording that is created through AI is not recognized as an official recording of the session, and Washington State reps reserve the right to exit trainees from the training if they're using AI to take notes without prior approval prior to the session. Additionally, materials, right? Your PowerPoint slide deck, handouts, all of that will be provided to you today in the chat at the end of the session, right? As we come to the end of our 90 minutes, I will make sure that everything is uploaded for you to download through the chat. Please note that materials and recordings will no longer be emailed to participants from Washington State. The recording for today's session will be available on the HCA FCS channel, Foundational Community Supports YouTube channel, approximately 2 weeks after the session has been finalized after today. Again, just some logistical points to remind folks, we are recording, so what you say or share will be a part of that recording. And again, I like to just gently remind folks that as we come into this virtual learning space together, that we want to engage with kindness, empathy, respect for all of the beautiful, unique identities that we bring into this virtual space, and to lead with curiosity. And with that being said, let's dive into our topic. So today we're looking more into the functions of supervision, right? We're going to focus on 3 specific functions. And again, if you are a supervisor, you can think along the lines of, how are you engaging in these functions of the supervisory relationship or process? And if you are direct service staff, you can think about, how am I receiving and engaging in these functions of supervision with my supervisor? Then we'll explore supervisory strengths and growth opportunities using techniques of nonviolent communication as a framework to navigate challenging conversations, and the use of appreciative inquiry, which is a strength-based approach to, again, communicating in supervision, whether it be individual, team, or otherwise. So to get our blood flowing a little bit on this topic, I'm going to ask that we have our first group activity. We're going to have small groups where you can comfortably discuss at your discretion, what you feel comfortable in sharing, how frequently you meet with your supervisees. You can chat with your group mates about what format are your supervisory meetings. You can talk a bit about what does your supervision agenda look like, or you can share one strength you have as a supervisor. You won't have enough to do all of these prompts, so choose one, right? As you go around your small groups, introducing yourselves, choose one of those particular questions to share with your group mates. I'm going to give approximately 8 minutes so that hopefully everyone has an opportunity to share. And then be prepared when we come back to talk a little bit about what came up, right? I'm going to share this slide to the breakout group room, so don't feel like you have to write these questions down. And if anyone is having trouble accessing their breakout group room, I can certainly assist you in that process. Okay, so I'm opening those rooms. You should get an invite. Let me make sure I'm sharing this slide. And I'll see folks back in approximately 8 minutes. You can also ask any questions. I see some things in the chat. Let me see. Some more folks introducing themselves. Great to have you all here today. Thank you. Anyone need help accessing their breakout group room? Let's see, I'm recording. So we just came back from our breakout group room and now we are kind of debriefing. I'm hearing having an open door and listening as a strength. Yes, the environment that we foster, how we encourage people to connect with us as supervisors or how staff can access folks as supervisors, and listening, being, present in those counseling relationships and those discussions, using our good listening skills, meeting staff where they're at. Holly, that is fabulous. Not expecting everyone to need the same support. We talk about how certain things that we utilize, right, in our service provision can be transferable skills to supervision, to leadership, to our supervisory approach. And when Holly, you say meeting people where they're at, I think of motivational interviewing. I think of MI. And we do that with the people that we're providing service to. And we also can do that for the staff that we're supervising, knowing that they're going through a process of professional development. And we can use our MI skills to get a better understanding of where they're at in a change process of learning new counseling techniques, learning new approaches to service conceptualization, and not expecting everyone to need the same support, right? That individualization. I love Melody leading in with curiosity. When we stay curious, that opens the conversation, right? When we lead with a sense of, tell me, I want to understand, I want to know, I want to deeply understand the experience, right? Looking to understand a person's perspective and worldview. Yes, there is culture in that room. When we are engaging in supervision, right? There are, whether it's team supervision, one-on-one supervision, there are different cultural identities, different, uh, you know, experiences. And we have to acknowledge those experiences, acknowledge those cultural facets. And with those identities comes points of power and privilege, or points of potential oppression and marginalization, right? And that is in that room, that supervisory space. Alyssa, yeah, they're both fantastic managers. They both sound like they know how to communicate. Communication is key in supervision. Yes, I love that. Great. So it sounds like you guys had a very fruitful discussion as you're thinking about supervision, right? When we think about supervision, what that really means, I'm going to see if I can mute. I hear something in the background. My apologies, but if you can, um, please try to mute. Um, so thinking about supervision, right? Oh, I'm hearing someone press phone buttons.
They muted.
Okay. Thank you. Thank you. So thinking about supervision, right? It is a process where, we are able to slow down with our team on a one-on-one basis or, with a larger group and reflect and to process, the approaches that we take in the field, the experiences that we have in the field. We can take time to expand our learning and supervision to gain support, as well as to look at this piece of accountability, right? And so supervision is, when we think about looking at the evidence of it, it's one of the most powerful workforce development tools that we have, right? SAMHSA defines supervision as structured, competency-based processes designed to protect individuals in service, to bolster practitioner skill sets, and to sustain professional wellness, right? Across many different models of supervision, and one we're going to learn about today, supervision consistently serves three core functions: administrative, educative, and supportive, right? And we want to see, right, a supervisor integrating all of these functions. That is really a good supervisor when they can interchangeably weave in, braid, right, these three functions. And we also see that, supervision is impactful when it has different modes. We're going to talk about that in our next session. What do I mean by modes? The way in which we conduct supervision. We know that we can have team meetings, individual meetings. We can also have meetings, what we call in vivo, in the field, right? Where there are live observations. We can have supervision sessions where we observe someone with a person in service, or we take a work sample, maybe with consent, an audio recording of someone's session, right? We know that supervision is strengthened when we have different modalities. We know that supervision, according to the evidence, is best when it's goal focused and structured, right? And where there's a lot of effort to bolster competencies as well as deliberately support a staff person's wellness. And lastly, and someone mentioned this, right? High quality supervision demands attention to culture and equity and inclusion, right? We need in our supervisory practices, and research demonstrates this, that when supervisors address culture and power and bias explicitly, right, supervisors report higher confidence, stronger working alliance, fewer instances of dissatisfaction or withholding information due to those power differentials and concerns. When we think about supervision, it is something that just doesn't impact a staff person's performance. It shapes the workplace experience. In many programs, right, the quality of supervision is one of the strongest predictors of staff satisfaction and retention. Go ahead and put in the chat if your organization has experienced retention issues, meaning turnover, right? Is your organization, yes, Y for yes and N for no? If your organization has experienced high turnover, if you constantly are having positions posted, when we see high turnover, that is disruption to team, that is disruption to a person's service, that is disruption to the workload of others, right? Because people may have to take on, right, additional service provision in the interim. There is lack of continuity of service. It impacts everyone else on the team in a way where maybe now they're experiencing a higher burden of workload and dissatisfaction, right? So high quality supervision moderates how staff experience their demands of work. And we see in literature that when supervision is structured and supportive and addressing those three functions, Staff have a higher rate of satisfaction, enhanced perceived support, and a higher commitment to the organization, right? People don't leave jobs. People leave bad supervisors. That is like constantly quoted. What do I see in my chat? Yes, absolutely. 1,000,000%, Mandy. Okay. Yeah, I hear that. Yes. No. Okay, that is like the outlier so far. Yes. Yes, Linda, very hard on the people that we serve. It's a disruption. When we have to tell our story, right, for a person in service over and over again with a new practitioner, that's exhausting, right? That is exhausting. And it tends to impact a person serves trust. How long is Amy going to stay, right? How long is she going to be here? Do I have to, retell my trauma to this new person? You're just going to leave anyway, right? So a lot can happen that erodes, kind of chips away that therapeutic alliance. We have lost so many people due to so much shuffling. Yes, Linda. Yeah, people get exhausted. They get exhausted, and it's understandable, right? So good supervision is a protective factor. It increases retention rates. Your organization is scratching their heads. What can we do to help staff get some good supervision? Improve that supervision process. It's interesting because we see oftentimes the longer someone has been at an organization, a staff person, they reduce, right? The admin will or leadership might reduce that person's supervision. Oh, they've been here, Amy's been here for so many years. She doesn't need to meet regularly. That is a misstep. When we reduce that supervision that was serving a purpose, right, we're then decreasing the support that that person is receiving, their connection, right, to their supervisor, and access to working through the things that are coming up, whether it's with people served, whether it's with their own wellness, right? So we don't want to just make assumptions. Oh, Amy's been here for so many years, she's good. She can do with less supervision. That really needs to be, right? Frequency of supervision should be assessed collaboratively. It shouldn't feel like a burden, and it should add to a staff's wellness. Right. So hear from you guys. When supervision has felt energizing for you, motivating for you, right? Recall those conversations. When you have received supervision that felt positive, energizing, motivating, type in the chat a word or two about what made those sessions work. What made those sessions work? Communication, yes. When you were asked, what do you need from me? Yes, right? When the supervisor said to you, how can I help? Trust, confidence. Communication is such a key piece of this. I'm seeing this as a theme. Patience, collaboration on attainable solutions. I love that, Giovanni. Yes, affirming language. They were listening with intention, collaboration, support, teamwork. So I'm hearing pieces of communication. I'm hearing having a strong therapeutic, or excuse me, working alliance with the supervisor. Both your supervisors are wonderful. Both are communicative and respond. That's fabulous. Yeah, and I'm sure that increases that intent to stay. Right, we see in the literature when we have good supervisors, it increases our retention and our intention to stay at our jobs. So supervision, again, isn't only about oversight, it's a retention strategy, right? Intentional balanced supervision provides improved satisfaction, job satisfaction, strengthens staff engagement, and keep our skilled staff invested in the work and in the mission and in their jobs, right? And so what does good supervision look like? Well, I mentioned 3 functions. You want to think about, right, from this session on, this training session on, how are you implementing these 3 functions? Well, what are they, right? I use Proctor's clinical model, and this breaks down supervision into normative, formative, and restorative supervision. And let's walk through each. Normative supervision is the function of supervision that deals with accountability and staff's adherence to policies, procedures, and ethical standards. This is your compliance function. This is, again, focused on policies, procedures, right? Is the staff person adhering to the norms of the organization, the norms of the field, right? Are they providing ethical service? It ensures that supervisees are delivering services that's aligned with agency protocol, legal regulations, professional codes, right? Think of this as your quality assurance domain. This might include documentation review, adherence to billing practices, role clarity, making sure someone is navigating their role to their job description, right? Attention to maybe scope of practice. Unfortunately, a common pitfall here is that we see supervisors leaning too heavily on this function, meaning that they're very focused on compliance, and that is really a singular dimension of supervision, right? They're coming into the supervisor is coming into their supervisory session, and it's heavily focused on normative supervision, and it's reducing supervision to a checklist, right? Amy, did you get your notes in on time? Amy, did you sign up for, the car utilization, the work vehicle this week when you have to do your job development or when you're taking someone to see a new landlord, right? Balance is key, right? Normative supervision must be accompanied by formative and restorative supervision to avoid an environment of micromanagement and fear. You can put in the chat, did you ever have a supervisor where their sole focus was this piece of compliance? What was that like? What was that like? Yeah, it drains the joy out of work. Yes, it sucked. It made me want to avoid the supervisor at all costs. Yes, it is quickly becomes an unpleasant interaction. You may feel very defensive. They didn't address us, see us, treat us as human beings. Yeah, new job, right? Time to find a new position if this is all you're receiving. I could hear that sentiment. It was toxic. It flattens the experience and emphasizes the power differential. Dylan, yes, it really becomes quite hierarchical, right? Where I am the authority, you are the person I oversee. I say what, I say when, and just report to me, and that's the extent of our exchange. It's very defeating. It was toxic, yeah. So gently take inventory, right? Normative supervision is important, but it needs to be balanced. Balanced with what? Our next function, oh, went too far ahead, is formative supervision. This is where the teaching, mentoring, and coaching component comes to play, right? This is when we take a role of helping people to form their skill sets, right? Formative supervision focuses on building and enhancing, bolstering clinical skills, service conceptualization, whether it's an evidence-based practice that we're helping them to develop, or maybe we're helping them to build their practice of cultural responsiveness, helping them to understand how to conceptualize services that include things like race, ethnicity, or culture, helping them to develop reflective practices. Right here, we are offering feedback on their interventions, their techniques. We're supporting the development of the staff person, again, of their service conceptualization, helping them to build career pathways, right? This is maybe where we are mentoring future leaders, right? Building succession plans for the team. We know that this is a very important piece of supervision. Effective Formative supervision uses role playing, co-reflection, can use in vivo or in the field approaches. I had a team of, I think it was 12 at the time, supported employment and support education counselors, and we did once a month audio recordings, right, where a person in service, with their consent and the formalization of that consent in a form, they would record a session with the practitioner, and we would just kind of like choose at random who would play their tape that month, paying attention to not um, having a person go back to back, right? Kind of giving everyone the opportunity to play a portion of their tape to demonstrate their approaches in sessions, right? Building an environment where learning was supported and encouraged, and using different modalities to do that. So think about formative supervision. What does that look like for you? What does that look like for you as a supervisor? Do you find that you spend time helping people to build their skills and competencies and interventions? How do we know which skills to build, what competencies to build? You could put in the chat, you could unmute. Anything come to mind?
What was the first part of that question?
Yeah, Melody, if we do it, if you're doing formative supervision, if you're spending time on it, and how do you know what skills to support to develop? Anything come to mind for folks? Be encouraging, design with their aspirations and skill development. Yeah, yeah. We definitely have to provide those positive affirmations, listening to their strengths, coach someone on communication, documentation, engagement techniques. I love that, Paul. I feel that's where communicating and listening comes into play. Absolutely. We can hear when someone is coming to us with a particular concern. Cameron, yes, personal performance goals, see how they're progressing, provide feedback and guidance. I love that co-creation of goals, and then that periodic check-in, making sure that that performance evaluation is not just a one and done, but it's something that's revisited throughout the year to see how they're doing, to intentionally develop their skill sets, coaching over policing. I love that. Coaching over policing. I've coached many new hires in other positions and asked after a week or so which areas they felt strong and competent in when they didn't, and then worked from there. Absolutely. That check-in, that dialogue can be so important, Demi, in getting a sense of what people are reporting. We can also pull from data. And what do I mean by that? Prioritization? Absolutely. Um, I would frequently look at, when someone was coming either for individual supervision or team supervision, they would report how many people, had jobs or didn't have jobs. I would look for trends, right, across that data. Maybe there were a lot of folks that frequently lost jobs quickly, right? And so maybe my role in this formative supervision was providing more team training, right? Looking at trends for the team on how to help someone with job coaching, right? So we can also, in addition to those conversations, look at the data to see where our program is really strong, where an individual staff person is really strong, and where they might experience some challenges, right? Or some concerns. And then that third function of supervision, and this is so important, is restorative supervision. And this is going to be the opportunity, the time that we have to address the emotional toll of care work. It's about being present with a staff person, and acknowledging the person behind that professional identity. especially in our high stress environments like behavioral health, supported employment, supported housing, right? Supervisees may experience vicarious trauma from the work that they do. They can experience stress. And so restorative supervision allows for those process of concerns, emotions, safely and respectfully. This is not therapy, right? This is our duty as a supervisor to check in with the occupational hazard that we experience of being in a helping profession, right? Restorative supervision is often the most frequently undervalued domain in supervisory practice, yet it is one of the most critical for sustaining our workforce, right? We really need to attend to that emotional support dimension in supervision. And again, it really creates space for supervisees to process the personal impact of their work, and what to do with that, right? How do we care for ourselves in the work that we do? Because we know, right, that if it's not attended to, then we start to see the impact of that, which is burnout, right? There are many facets, right? Burnout is multifaceted, multifactored, but one key aspect of burnout that we may have some locus of control over as supervisors is providing restorative supervision. And we know burnout is really defined by emotional exhaustion, depersonalization, reduced sense of personal accomplishment. Burnout affects our field so very deeply. And we know that burnout is very prevalent, right? It can be in some organizations, in some states, a public health crisis in our helping professions. And its impact is felt across every layer of an organization. It is, again, characterized by that emotional exhaustion, depersonalization, reduced professional efficacy. And it's not all or nothing. It's something that is experienced mentally and in stages. And so as supervisors, we can intervene. We can help that staff person to stop that process of burnout creeping in, right? And why? Why do we want to address this area of our field? Well, one, burnout compromises staff, right? We know that when burnout is high, when someone is scoring high on burnout, empathy declines. Problem solving also deteriorates and errors increase. Burnout leads to higher rates of absenteeism, presenteeism, which is working while unwell, and ultimately burnout contributes to staff turnover. Professionals in our field could feel disengaged. They can lose confidence in the work that they do, or they can leave the field entirely. We know that burnout impacts our organizations, right? And I think there was a research article that estimated the cost of burnout related turnover and reduced productivity. And it was like something like almost $5 billion annually, right? There is a high cost of burnout. And most importantly, there is an impact on people served, right? When people are receiving services by a practitioner who is experiencing burnout, we see in the literature reduced access to quality care, inconsistent relationships, that therapeutic alliance, and practitioners report diminished hope, right? As well as the individual served. The individual served will report diminished hope when the provider is experiencing burnout. And we know that the therapeutic alliance, that ability to connect and work effectively with people in service, that can be a strong predictor of successful outcomes. So we want that practitioner, that staff, to do that work effectively. One of the great things that we can utilize in our restorative supervision function is assessing burnout. I feel like the slide deck is a little janky today and not cooperating. I'm going to put my first resource in the chat. This is a link to the ProQual. Love this. I've used this assessment in my personal practice for myself. I've used it for supervisees. I've used it in research studies at Rutgers University. And the ProQual is the professional quality of life, and it's one of the most widely used tools to assess the emotional impact of working in the helping profession. It is researched, it is validated, it is free, it is a self-report, and it helps you, the supervisor, to measure your own wellness, and it can help your supervisees to monitor their wellness. There are 3 interrelated subscales: compassion satisfaction, burnout, and secondary traumatic stress. And what I love about this is that it measures compassion satisfaction. We know that compassion fatigue leads to, and it has that integrated or intertwined relationship with burnout, right? Compassion fatigue is when we are experiencing the stressors of our relationship, of our work relationships and our work that we do. Compassion satisfaction is the pleasure that we derive from doing our helping professions, right? From working in our field. And so this can measure if someone is still experiencing compassion satisfaction. Again, that pleasure and the value they get from being in the helping profession. And that's a protective factor to burnout, right? If someone is experiencing high levels of compassion satisfaction, that's a protective factor to experiencing burnout. So I encourage you after today to use this, to click on it. I see someone in the chat is saying that they've done it before and it's very informative. I love that. I love when you're able to use resources and have access to tools that can strengthen our knowledge about, wellness in our staff and in ourselves. But again, it's no cost, it's free, it's a validated tool, and it can help staff to really see, where am I at? And what can I improve upon? And that's definitely a tool to bring into that restorative supervision, to check in on people and to see, what could be different in managing wellness at work. And again, restorative supervision is not counseling, it's not therapy. It is the ethical responsibility of the supervisor checking in on the mental load and the occupational hazard of being in a helping profession. You can certainly work with administration to direct people to employee assistance programs, right? If the need that they're experiencing is greater and crosses the boundary of supervisor/supervisee. But this can be a very assistive tool. So I'm going to put my next tool into the chat. This is a worksheet that helps you to explore your supervisory approaches. And I'm going to put you back into your groups. And I'd like for you to reflect. I'll post this slide as well. The worksheet that I just put into the chat kind of mirrors this in a little bit more detail. Just talk with your group members where you're coming in at. Like, if you had to divide your supervision time spent in percentages, right? How would you divide that 100%? Where would it go to these different areas of supervision? Are you doing 50% restorative supervision, 20% normative supervision? Just check in with your colleagues to get a sense of where you fall. I'll see you guys back in about 5 minutes. And bear with me, I want to make sure that everyone is in the room and has a group member present. So please let me take some time to make sure that everyone has a partner. I don't want anyone to be in a room by themselves. I do see some people not assigned, so I am sending you into different rooms. If you are in a room by yourself, I will try and go in and move you around so you have partners. All right, let me pause the recording again. Okay, so I'm gonna hit the resume our recording. So just be mindful as we debrief and go over how did it go? What came up? Any surprises? Any themes? Any um parallels, or maybe some things that were incongruent with what your colleague shared? You could put in the chat, you could unmute, anything that came up in your groups.
Hi, my name is Martha Lynn, from Misty's Family and Other Services. So I will, can you hear me?
Yes,
Sorry.
yes, I can.
Okay.
Thank you so much.
So part of what we shared was the burning out. And I also shared about at Misty's what we do because so, like their case managers jobs are sometimes like hard, and then their workers like burn out sometimes. So one of the best thing that I love about Misty's is that there's that one day where you get to take off and you get to freshen up, and also they, even though the job is important, but also their staff members also health is pretty much important as well. And so you have that day that you can take off and be able to catch up with your mental health, like mental health day. And then also they respect like the staff members and respect even the clients, and everybody just like collaborate together properly. I like working in other facilities, never saying like their kind of togetherness. And so talking about the brand out, I just wanted to share that as well. Very much important that we also take care of ourselves, because if we're not taking care of ourselves, obviously we're not going to be able to take care of our clients as well. So thank
Thank
you.
you, Martha, for sharing a bit about what came up in your group and the importance of that restorative supervision that often very much deeply touches people on a personal level. It resonates with their experience, whether their own experience of having side effects of the work that we do in terms of burnout, or the staff that they oversee. And so, yeah, it can be in a really important piece of how we operate and the environments that we create. I love hearing about that, the day off, and thinking about like mental health days. That's great. Melody is saying that normative supervision is really prevalent. It's one of the more like default models of supervision. Any thoughts on that? Any thoughts on what Melody and Martha Lynn had shared? Again, you could put in the chat, you could unmute. Was the worksheet helpful for folks and kind of like checking in and thinking about the time spent in each of those sections? I think when we really make that a concrete discussion, right? Where is the time allotted? It can call gently bring our attention, right, to our practice and process. And so hopefully that's something that you can take back to your work, to your agency, as a gentle reminder to spread that time out, regardless of what type of supervision you're doing, whether it's normative, formative, or restorative. Um, Communication is key, and we heard that time and time again in our chat, in things that people have shared. Right, communication is such a critical part of supervision. And so I want to bring your attention to another technique, a communication technique that can help you to navigate supervisory discussions. And again, this is going to be applicable for all three functions of supervision: normative, formative, and restorative. And that's nonviolent communication. Right at the heart of supervision, like we said, is communication. It's not just what we say, it's how we say it. One framework that really we see is transformative and assistive, and whether it's difficult conversations, emotionally charged conversations, conversations that can be perceived as hierarchical, is this piece of nonviolent communication developed by Marshall Rosenberg, and it's frequently referred to as NVC. So NVC isn't about being soft; it's about being clear, indirect. Also, as we invite that transparent discussion, it's about holding compassion while we do it, even in times of tension or conflict. In supervision, this means replacing judgment with curiosity, blame with inquiry, and replacing criticism with very clear requests. And I think this is especially critical when discussing staff performance, navigating disagreement, um, or exploring emotionally charged topics like burnout or crisis with a person served. And it's built around two pillars and four components. And those are as follows. Okay, if we look more closely at the structure, we see, if you're going to put it into your practice, we want to pay attention to both expressing and receiving, right? Communication flows two ways. Communication is bi-directional. We're expressing it, we're receiving it, and we're going to do so using these four components, which are observation, right? Assessing or speaking to fact without judgment, feelings, naming emotions rather than masking them, looking at needs. What are some of the needs that are a piece of that discussion or that experience, right? Unmet values, priorities that are driving the feelings that are coming up, and requests, specific, actionable, attainable, respectful requests, right? In supervision, we may focus heavily on feedback, but feedback without clarity, feedback without empathy, can really feel like negative criticism. So nonviolent communication, NVC, teaches us to move away from "you didn't do this right" to, right? I noticed that your documentation wasn't completed within the 24-hour mark, right? That's the observation, right? "You didn't do this right" is a judgment. Whereas I noticed your documentation wasn't completed within 24 hours. That's an observation. I'm concerned. That's my feeling. Because timely documentation supports our person served and our billing needs. That's a need, right? I'm saying I'm concerned, my feeling, because documentation has to get done for our billing, right? And then the request. Would you be open to discussing what got in the way and what might help moving forward, right? This approach really preserves dignity, collaboration. It's non-hierarchical. It is a direct conversation that gets at solutions, right? It's very solution focused when exploring the need and the request. So in supervision, anything come up for you when hearing about expressing or receiving information in regards to these challenging discussions? Anything that feels harder for you, right? Is it challenging to have discussions without judgment, to express or to receive information without having, judgment or assumptions? You can put in the chat, you can unmute. While you're looking to share, I want to emphasize that using nonviolent communication doesn't mean avoiding accountability. Accountability is very present in these discussions. It means that our communication will engage with the person from a place of connection and clarity. It really helps to create what the author refers to as psychological safety, which is a foundation for learning, for creating a work environment that is transparent and values honesty, and it fosters resilience within the supervisory relationship. People think that, oh, these conversations, they might chip away at that working alliance. It's the exact opposite. When we move through challenging conversations using this format, it actually bolsters the relationship because that person will then know, like, right, Amy is a trustworthy supervisor. I see, Alyssa. One of the most important things we talked about was the ability to feel. Usually this work it can be rigid, the ability to be human. I love that. Yes, our humanity is present in the work that we do. And that's, what we have brought us to this field. And that is something that can put us at risk, for burnout because we are coming to work with ourselves fully present and offering that unconditional positive regard, our humanity, our empathy and kindness. And so I think that's important to foster that, to care for it, to nurture it, to protect it. I love that. Not Melody, or without feeling judged. Yeah, it's hard. It's hard to make sure that we are communicating without judgment or without feeling judged. Yeah, from the other person, of course. And so
Would
nonviolent
you mind?
communication.
I'm sorry, I have a question.
Yeah.
Can we back up really quick? For your component number 3, needs, can you share that example again that you used
Yeah.
on
So
needs?
needs are unmet values or priorities that are directly driving the feelings that we're having. I think I gave the example of documentation. And so
Right.
not using nonviolent communication, I might say, you didn't do this right, or you're so incompetent, right? You just can't get this done, can you? Right? Those are, um, I'm masking my feelings, but the feelings are present. I'm not saying what they are, but they're present. There's a need that I'm not speaking, and I'm not observing, I'm judging, and there's no request, right? That is like ineffective communication, and it creates a hostile top. So someone said earlier, like they think about supervisors like that, and it's a toxic work environment. So we can flip the conversation by saying, I noticed that your progress note wasn't completed within the 24-hour time frame. That's my observation, right? I'm just stating fact. Now my
Okay.
feeling is I'm concerned, right? I'm concerned because we can't bill for service if the documentation isn't done in 24 hours. And then so I'm concerned is my feeling. And then the need would be, right, that the billing has to get done so that we can get paid, essentially, right? That's the need. And then the request is, would you be open to talking a little bit about, what those barriers are and how we can improve going forward, right? Observation, feeling, need, request.
Thank you so much for repeating that.
Yeah, of course. Yeah. Yes, Melody. Exactly. Exactly. And so, when we think about nonviolent communication, the flip side, right, is that there are these communication killers, these compassion killers, right? This is what gets in the way of effective supervisory communication. Humanizing someone said that earlier, humanizing supervision. And these are subtle and sometimes unconscious habits that the Rosenberg calls compassion killers. First, judgments. Judgments are language pieces that label people or actions with moralistic evaluations, right? Disrespectful, lazy, non-compliant, unprofessional. Judgments really collapse observation, interpretation into like a single verdict. And this is going to trigger defensiveness and shame. And when someone is in a place of defensiveness and feeling shamed, embarrassed, that reduces a person's ability to be present in the conversation. It can, trigger that prefrontal cortex, our higher brain processes, to shut down from that flooding, emotional flooding. It will reduce learning, and it certainly will reduce disclosure. We mentioned that earlier, right? When we're feeling like someone is really um, scrutinizing us, we don't want to share. And so this results in a person masking their feelings, right? Masking their needs, right? It narrows options down to, punishment compliance rather than problem solving. And so we want to, again, move away from that judgment with making observations, starting with that observation piece. And that might look like, someone saying like, she's unprofessional, right? That's an example of what not to do. That's a judgment. To using nonviolent communication, I might say, during yesterday's session, I heard 2 sarcastic remarks about attendance. I feel worried because I want people in our service to experience dignity. That's the need, right? I feel worried is my feeling, and then my need, I want everyone in our service to experience dignity. Can we role play alternatives you could try next session? That is my request, right? I'm making comparisons, evaluating self or others by ranking against someone else or an ideal, right? Melody's better than Amy, right? Team A is better than Team B. I'm not good as, right? In nonviolent communication, comparisons pull attention away from needs and towards status or scorekeeping or competition. It feels unsupportive, right? People may feel resentment or shame. There's less collaboration. Support needs might not be met. It encourages favoritism, um, and really threatens collaboration amongst the team. So how to recognize that? Hearing someone say like better, worse than, best, least, more dedicated, right? Using one person as a standard, or vague praise or blame, right? Without behaviors anchored. Right. So we want to avoid things like someone is better at someone else than, at engagement, or the team isn't like the morning team, whatever, those comparisons might be. And then Rosenberg also identifies denial of responsibility as a common barrier to compassion, connection, and providing good supervision. And it happens when people use language that they suggest that they have no choice in their actions, right? When responsibility is shifted to rules, policies, right? Rather than personal agency. Phrases like, I had to, it's policy. Oh, admin made me. I'm just doing my job, right? As a supervisor when we say these things. So Rosenberg really invites us supervisors to reclaim our agency and our choice to speak in a way that acknowledges our actions. So that might look like, I have to write you up, right? When someone says, I have to write you up, it's policy. Um, and so that it's shifting it, taking responsibility would look like, I need to document this situation, because consistency and safety are important to me and to the program. I know it may feel frustrating, and I want to talk with you about that and what might support look like moving forward, right? So moving from this denial of responsibility, no agency as a supervisor, like I have to do this, it's policy, to like taking ownership of that. I'm choosing, I have to, right? This can be very impactful in working with individuals, especially when we're in a spot where we have to support performance improvement. I think I see something in the chat. I see a bunch of things in the chat. Sorry. Oh, yeah, when a supervisor is talking about other staff, that is, yeah, it's certainly a thinking about like comparison that takes it above and beyond, right? And we'll definitely bring in all of those pieces of competition and fostering a sense of disconnect. That is a hard environment to be in, where the supervisor is not taking accountability for their behaviors in that environment. And so I know we are coming down to the last bit of time, so I want to put into the chat our worksheet on nonviolent communication and appreciative inquiry. As well as, let me make sure I have these PowerPoints in the chat as well. Okay, that is entered. And while I'm at it, I'm also going to put the survey for today into the chat. That way I don't forget. Okay, so that link is there as well. So the key to observation is really making sure there's no evaluation, right? And this can be difficult because oftentimes we were raised to interpret or to, make clinical hunches, assume, react, to not pause or truly describe, what we're observing. And so we really want to make sure that we are keeping things just to what we are observing, just the facts, right, of the situation, whether it's, I've noticed that you have been out for the last three Fridays, right? Or I've noticed documentation hasn't been on time, that certain notes have been past the 48-hour threshold, right? Keeping any judgment or assumption out of there, language that is just describing what we're observing. Feelings, right? This can be challenging as well to, once, we have made our observation without judgment, to then name our own feelings. I feel like this is kind of deceptively simple because most of us have never learned to bring into our conversations at work, our professional conversations, our feelings without, blame or deflection or, we've tried to mask our feelings. So naming a feeling, I think can be risky for some folks, especially in that professional setting where it's like, oh, stay objective. But I think supervision, especially defined by Rosenberg, is relational. It's a relational process. And when we express genuine emotion without shame, guilt, aggression, we model, again, that psychological safety. And I think that goes a long way for preventing burnout as well. We open the door for supervisees to explore their own emotional responses, which is a necessary step in all of our reflective processes, right? So it's, again, just sharing, I feel disconnected, right? That's a feeling. I feel hurt. I feel concerned, right? We have those big, beautiful feeling wheels that we can bring in to our conversations to share, how things can be impacting us in that exchange or experience.
Amy,
And then, oh, yes, Melody.
the survey link is actually the registration link.
Oh, my apologies. Let me get the right link in.
Thank you.
Oh, maybe I accidentally did not copy that into the chat before. I'm going to put that up in just a second. I think I have a QR code for it. I did not enter it into the chat. Thank you, Melody. And then this piece about need, right? According to Rosenberg, every feeling, whether it's frustration, joy, pride, is a signal of a met or an unmet need. And in supervision, we can help ourselves or our supervisees to name those needs clearly. Then we move from blame and defensiveness to problem solving and connection, right? Needs are universal. Things like support, belonging, contribution, clarity. And we don't want to confuse needs with strategies or demands that can, create conflict. But we can say, I need more clarity. I need, space to take a pause, right? Whatever can be assistive in having that open, productive conversation, right? And then the last piece, requests. Requests are not demands. It's an invitation for collaboration, not an ultimatum for compliance. In supervision, especially in environments where there may be that interpretation of hierarchy, the line between requests and demands may feel like a little blurry, and how we frame it matters. It keeps the focus on partnership and mutual accountability, even when we're discussing, serious issues like documentation errors, performance concerns, or boundaries or ethical violations, right? So that may move from like, you need to fix this immediately, or there'll be consequences to, I noticed, follow-ups with employers have been delayed for the past 2 weeks. I'm concerned, I feel concerned, because timely employer contact is critical to building trust for job placements. I need us to uphold that standard. And then the request, would you be willing to set aside 30 minutes just for employer check-ins each week? Right? It's a specific request. It's a request that is manageable. It's inviting a person. It's giving them, that would you be willing, right? To collaborate on that problem solving together. Okay. So I am going to did I put survey? I thought I put the survey link. I'm going to ask, what has been a takeaway from today's session?